All right, thought I'd take a little break between patients and let you guys know if you're interested in some thyroid testing and really figuring out why I have a thyroid issue, or it seems to be thyroid symptoms and yet my blood work seems normal, or at least my doctor says it is. This is what we're going to talk about here with these videos. The first one is just running a deeper dive, what we call our super panel for the thyroid. Your typical doctor endocrinologist will run this much. We want to get down to the deeper levels. What else could be going on which can affect your thyroid? All right, things that can be related to the thyroid directly, such as your thyroid antibodies, both TPO antibodies, your thyroglobulin antibodies, this thing called reverse T3, which tells us a lot about how the thyroid hormones are functioning or not functioning. So we can run that panel, which is much deeper than what the typical traditional doctor will run, all right? So we'll oftentimes send patients for that. In that same panel, we might also look for some other things which can cause an overreactive immune system, like viruses, right? And we want to run panels for things like Epstein-Barr, Lyme's disease, which is not necessarily a virus, but it does kind of act like a virus on the cells in terms of affecting our thyroid. We want to look at herpes virus. We want to look at mycoplasma pneumoniae. Sorry about that. So we want to make sure those aren't problematic. We want to look at Coxsackie virus. There's a bunch of those things we want to look at, right? So we do all that through the blood work. Other things that we want to look at: magnesium and zinc, important minerals to the thyroid. Things like iron and ferritin, which is stored iron. We want to check those on the blood work. That can indicate some thyroid issues. We want to test you for celiac disease. Are you able to process gluten or not? And then vitamin D is the other one. So there's a bunch of things your doctor hasn't looked at. These are the things we want to do with our blood work. This is what we do as part of our functional medicine approach. So just know that if you're getting your symptoms related to thyroid, you need to see a doctor who actually can test and see how much of what's going on with you is creating this thyroid problem, and not just a matter of, here, just take this medication, it'll take care of it. We want to get down to the root cause of that issue. All right, so just know that that is a test that we oftentimes will run for our thyroid patients. Now, if you haven't already, in the description to this video is a way for you to get a free call, basically what we call our discovery call, where for 15 to 30 minutes, any questions you might have about functional medicine, we're going to answer for you. Gives us an opportunity to make sure what's going on with you is something we do think we can help with. So in that description to the video, click on that link and you'll get an opportunity to schedule that free call. Take advantage of that today. That helps us start the ball rolling towards figuring out what needs to happen with you next. Okay, so get on that discovery call, get that scheduled. All right.